You are listening to Concussion 101, a patient's guide to getting ahead again. Episode 3, Troubles with Mr. Sandman. Today your host, Ms. Caitlin Haino, occupational therapist at York Region Concussion Clinic, will explain how concussions can affect sleep and what can be done to reset the natural sleep rhythm. Enjoy.
So the tables are turned, Miss Haino. I'm interviewing you. I'm Dr. Chugh, the medical director at the York Region Concussion Clinic, and we all depend daily on Caitlin's expertise and assistance in sleep-related matters. So I'm going to kick off this interview by asking you a simple question. What happens to our sleep after a concussion?
It's a good question. Sometimes nothing happens to your sleep, but for about 50% of people, after a concussion, they do have changes in their sleep. The most common problem with sleep after concussion is insomnia, which is difficulty falling asleep or staying asleep. To a clinical degree, of course. Obviously, we all have some difficulty with sleep from time to time, when there's something on your mind. The idea is that insomnia should cause distress and should impact daytime functioning to really qualify as a clinical condition. Although, other problems may also exist, such as sleeping too much, irregular patterns of sleep, or a shift in your sleep schedule. Those are other common ones.
What are some of the uncommon things that can happen after a concussion with respect to sleep?
All right, getting a little bit more interesting here. So some unusual behaviors during sleep or transition stages, which we call parasomnias. The most common one of these is REM behavior disorder. This is where patients lose their normal physiological paralysis during REM sleep. We'll talk more about REM later on. The idea is that they act out their dreams, which is pretty cool. Concussion patients are more commonly noted to have restless leg syndrome and sleep apnea than people in the general population. We're not really sure if concussion causes these problems. That is, they may have had it before their injury, and we're just more likely to catch it because of all the medical attention that they're getting as a result of the concussion. But obviously, addressing these issues will help people with recovery.
What are some of the reasons our sleep may change after a brain injury?
There are a few of them. I won't get into the nitty-gritty. Sleep is a result of several fairly complex systems in the brain, and as concussions often result in fairly diffuse neurological effects, the impact itself and that subsequent cascade of neurotransmitters can both disrupt the sleep circuits in the brain. There may be changes in the timing and rhythm of sleep. This can result in a mismatch between that biological sleep-wake schedule and that desired 24-hour environmental and social schedule. This happens because there are changes in the rhythm and the timing of melatonin secretion and body temperature. The most common circadian rhythm issue post-concussion is delayed sleep phase syndrome. This is a condition in which the individual's normal sleep cycle is shifted, so their biological rhythm is disrupted, and they often can't fall asleep until late at night, and then because of that, they have a later morning wake time. And often the requirements of society, like work or school, result in insufficient sleep. So parents, it's good to note that it's a common condition even in teenagers who haven't sustained a concussion. And, if you're giving your teenagers a hard time about their late sleep and, waking up late and always feeling tired, there's a chance that it might not be their fault.
So are there some patients who are more likely to be affected by circadian issues post-concussion?
Well, yeah, obviously teenagers, and they're a big chunk of those patients that we end up seeing in the clinic. Also, circadian issues are more common in concussion patients who have visual consequences. Our circadian rhythms depend a lot on the light that we see. And remember, circadian rhythms are your body's internal clock. Visual problems might, 1, cause people to avoid the light because of sensitivity to it, or 2, the eyes themselves may lose the ability to use light to entrain the circadian rhythm.
What I've noticed is that after a concussion, patients' lifestyles change quite a bit. How does that impact sleep?
Good question. So I had a client who used to live a very busy life. She ran about 10 kilometers a day. She was kickboxing, playing sports. She was working full-time at a pretty demanding job and was a single mom, pretty much Wonder Woman. The injury occurred, and then she was a lot less active, and she needed a lot less sleep. I was a little bit concerned about that. But remember, if your lifestyle changes, if you do different things during the day, sleep is also going to change.
So how does mood affect your sleep?
Yeah, that's a pretty good question. So sleep disturbances are common to a lot of mental health conditions. So as we discussed during previous episodes, they may emerge or could be exacerbated by the concussion. So sleep issues could be secondary to those conditions, things like anxiety and depression, or side effects from medications used to treat those.
So why do we need sleep?
Yes, another terrific question. Very profound. Sleep and wakefulness and arousal are all competing systems, and like any new mothers out there will know and no doubt appreciate after sleep training their babies. Essentially, your sleep is controlled by two things: your sleep drive and your body's internal clock. So the need for sleep increases throughout the day as you expend energy. That's the sleep drive. It controls the quantity of sleep you get and also the quality. That sleep drive is really focused on getting you that deep sleep. Your internal clock, so that's the circadian rhythms that we discussed earlier, is a little bit trickier to regulate, but exposure to daylight helps with that process. So it regulates the timing of sleep and wakefulness. But to go back to your question, the interesting answer is that we don't exactly know why people sleep. We know that we need it. We know that without it, things are pretty rough, but we don't have a great answer to that question yet. So an interesting fact is that some animals can go for long periods of time without sleep. Marine mammals, the research was done in dolphins and orcas specifically, but they can spend long periods of time, 4 to 6 weeks even, without sleeping after giving birth. Cool, eh?
That is cool.
Yeah, so we're not sure that sleep is entirely necessary. One hypothesis is that sleep provides an essential restorative function. So that's supported by the fact that without sleep, we don't function optimally psychologically, physiologically, or cognitively.
So will a good night's sleep help us recover faster?
Yes, I think we've all heard that old saying that sleep is the best medicine.
I thought exercise is the best medicine.
All right, well, they do go hand in hand, as we can all relate to. If we don't get enough sleep, this can impact our functioning and can result in changes in mood and can impair cognition, so you won't be solving complex mysteries when you're sleep deprived. But sleep may also be restorative to your brain's energy patterns. Essentially, when you're sleeping, there's typically less activity in the brain. During the day, the brain uses up a huge chunk of your body's energy. I mean, it's running the show, so to speak. When you're asleep, less neurons are communicating, less synapses are active, so this lesser activity in the brain is conserving some of the brain's energy, which may then be used and allocated to healing.
Pretty interesting. What's the relationship between cognition and sleep?
Yeah, so there's some experimental evidence that suggests that sleep may actually play a role in brain plasticity by promoting learning-dependent synapse formation and maintenance. There might be a correlation between training motor tasks and increased slow-wave sleep. Sleep may also enhance memory consolidation and promote long-term potentiation. An example, newborns spend more time asleep, and in particular, they have a higher proportion of REM sleep. Some believe that the sensory input that occurs during dreaming, as well as motor cortex activity, plays an important role in brain development. Non-REM sleep, meanwhile, may impact learning by returning saturated learning circuits back to baseline levels. That's the restorative function of sleep that we discussed earlier.
So what happens in my brain while I sleep?
Another good question. Sleep works in cycles and stages. There is a lot of variation through the night. It's not one continuous state of being. Also, I'll just say right off the bat, a lot of people confuse deep sleep and REM. They're very different stages of sleep, but we'll go through all of them first. We'll get to REM and deep sleep later. First, what happens when you start falling asleep, you begin with stage 1, or NREM 1. This is light sleep. It's a very short stage. It usually only lasts a few minutes. Sometimes you even alternate between chunks of that stage 1 and being awake as well. So you might notice late at night that you're missing chunks of a TV show or a book. You don't necessarily feel like you were asleep, but chances are you grabbed a bit of that stage 1. After stage 1, we go to stage 2, sequentially. That's the stage with sleep spindles. It's still light sleep, but your brainwaves are starting to slow down.
Then we get to that deep sleep.
Yep. So after stage 2, we have stage 3. That's the beginning of deep sleep. What happens is that your threshold for arousal increases. It's harder to wake you up. Brain activity starts to become more synchronous. You're easing into deep sleep. Then we have stage 4. That's the deepest sleep. We also call stage 4 slow wave sleep because you have a lot of slow, synchronous activity in the brain at that point. So all of the neurons fire together. Not much is going on in your brain. If you were to stick EEG sensors on, essentially to look at brain waves, you would see a very smooth wave. And that deep sleep, that's when your body goes through that restoration and healing.
So when do we get into REM sleep?
All right. So right at the end of that sleep cycle, REM sleep is when you dream and you might have nightmares. Interestingly, REM sleep has typically been associated with vivid dreaming and nightmares, except in PTSD, where nightmares can occur in stages 1 and 2 of sleep. Usually in REM sleep, your body is paralyzed, other than that rapid eye movement for which the stage is named. But some people post-concussion have incomplete paralysis and may actually act out their dreams if the lack of muscle tone is incomplete or absent. Although typically, REM sleep, your brain is very active. The neurons fire asynchronously, so just like in waking. So that's sort of short bursts. If you were to look at an EEG, those brain waves here during REM sleep, it would almost be more of a flat line because a lot of neurons are firing short bursts at different times. And we remember from physics that opposing waves cancel, right? Yeah, same idea here.
So how do I know how much sleep I need?
It's amazing the number of clients I get that are concerned because they can't get 8 hours of sleep. I think somehow someone must have published the fact that, you need 8 hours of sleep. But it's not true. It's in that average range, but everybody needs a different amount of sleep. Some people function well on 4 hours, other people need 10. It really just depends on your brain, your lifestyle, and what you're used to. So often when I question people about not getting those 8 hours, they tell me that they still feel well rested. They have no other difficulties with sleep. So then it's not really a problem.
So our lifestyles can change from day to day. How does that affect our sleep?
Yeah. A really cool thing about sleep is that it's an efficient system. Your brain adapts the structure of sleep to how much you're getting. Think about it. Imagine you've spent a fun cottage weekend with friends. You don't sleep too much, you're still functioning okay. Anyway, the point is, it only really takes you a night, maybe 2, of a little bit extra sleep, or even your normal amount of sleep to recover. The idea is that you don't need a proportional amount of extra sleep to make up for lost sleep. It's really cool. So to answer your question about how much sleep you need, it's really different depending on the individual. You'll feel worse if you sleep too much, but also if you sleep too little. You can function well on less sleep because you'll change the structure of your sleep to get more deep sleep and reduce the amount of REM. And just to note, after a concussion, it's also common to be sleeping a little bit longer than usual. That's your brain working to heal itself. It's nothing to be worried about in the short term, unless you're sleeping very excessively.
So can I do anything to improve my sleep?
Absolutely. There are many different types of therapies that exist. I'm going to focus on sleep hygiene, and then we'll discuss medication briefly, and then cognitive behavioral therapy for insomnia, which is my favorite. So, sleep hygiene, let's start with that. I'm going to go into more depth on this because while it's not necessarily an effective cure for insomnia on its own, the principles are important ones to implement. Essentially, sleep hygiene is not my go-to, but it's very important to ask clients some of these questions because you might be doing something that's taking away from your ability to sleep. Also, sleep hygiene, they're really just good strategies for building healthy habits to promote sleep.
What are some things that make up good sleep hygiene?
When I think sleep hygiene, I think about routine, lifestyle, and also environment. So here are a few select sleep hygiene tips. Let's start with routine. I would keep sleep consistent. Go to bed and wake up at the same time each day, even on weekends after a wild night, for you non-concussed patients, of course. Your body's internal clock, so that's those circadian rhythms, it does much better with regularity. Sometimes a bedtime routine can also help you relax, unwind, and start to associate some of those aspects of the routine with sleep. Another tip that I give people is not to nap if you're having difficulty falling asleep at night. This is a tricky one because if you're not having any difficulty with sleep, naps probably mean that you just need a little bit extra. But if you're finding that your sleep is impacted during the night, it's very important to try to avoid naps during the day.
So what are the lifestyle tips you give?
All right, let me start with an example. So once I forgot to ask about caffeine. This was fairly early on because I assumed that it was just common sense that if you drink a lot of caffeine prior to bed, it's probably going to impact your ability to fall asleep. But now, after that one patient, I never forget that question. So, other than not drinking vast amounts of coffee before bed, make sure that you get lots of light exposure during the day. Try your best to eat healthy and try to eat meals throughout the day rather than one heavy meal before bed, unless your aim is that Thanksgiving food coma. Exercise is also one of the best things that you can do, although this does get complicated after a concussion. I wouldn't pick your own exercise. I wouldn't start that before speaking to a healthcare provider after a concussion. But that being said, It's interesting. Studies show that people that exercise more typically need less sleep.
We hear a lot about having a sleep environment that facilitates sleep. Can you talk a bit more about that?
Yeah, that one's fairly simple. I think it's pretty common sense. It's much easier to sleep in a dark, cool, quiet environment. I would also try to keep your bedroom a calm, relaxing place. Try to only use your bed for sleep and sex, if possible.
Other than sleep hygiene, what is another strategy you use?
In some cases, we use medication. Medication is not my area of expertise, but isn't it handy that you happen to be a medical doctor?
Well, as you know, medication is something we don't use that often. Since we started this program a year ago, we've only used it in, I think, 2 patients. And that, if I remember correctly, only in the first week. I think between the 2 of them, we only gave them 10 pills of Ambien.
Yeah.
We also used Prazosin in some people with PTSD and nightmares. And then we use some melatonin in people with circadian rhythm issues. But other than that, we more commonly work with the patient's GPs to get them off medications or to switch them to other medications that will help them get better from this concussion faster.
All right. So here's a question for you. Most of us assume that we can go to a doctor to get medication to help us sleep. How come that's not the cornerstone therapy for sleep?
Most people are interested in a cure. They just don't want a Band-Aid solution. And this is why we start using things like CBT-I, because this addresses many of the things you just mentioned. So we use CBT-I, biofeedback, relaxation training, energy management techniques, initiating a cardiovascular exercise program. For those kids with those delayed sleep phase syndromes, the work and school accommodations help a lot. Cognitive compensatory strategies so they don't feel so taxed at the end of the day. Mindfulness helps. Improving one's diet. For those people with circadian rhythm issues, phototherapy is really useful. And just treating their other medical issues like headache, neck pain, vitamin or mineral deficiencies, and so on. Most people can see how all of that can be much more powerful than just a pill.
Okay.
And in fact, medications have side effects. And for many concussion patients, those side effects are not ideal. They can increase fatigue. They'll change your sleep architecture. For example, they usually affect REM or REM sleep. They can cause cognitive problems. They can cause problems with your eye's ability to accommodate. They can lead to more light sensitivity and headaches. And then upon stopping them, you can get rebound insomnia or vivid dreams, nightmares. And for all these reasons, concussion patients have heightened sensitivity to medications and for other reasons. And so we try to avoid using them unless we feel the juice is worth the squeeze.
All right. So when would you recommend using medication?
The area where we most commonly use medications is in patients with persistent headaches, despite compliance with some of the treatment recommendations we mentioned. It's usually migraine patients, and the medications are helpful because getting rid of those migraines will allow them to regulate their lifestyle and it'll help them comply with treatment recommendations a bit more. A lot of those medications also help with sleep as a side effect. Although in choosing a medication for headaches, we run into the same challenges with side effects I mentioned earlier. And so it becomes a bit of a cost-benefit problem. Interestingly, we've had good outcomes with cannabis in some concussion patients.
Yes, we have.
But let me bring it back to you. Can you discuss more about the cornerstone of sleep therapy, this cognitive behavioral therapy for insomnia, or CBT-I?
Absolutely. It's my favorite. So it's just as effective in the short term as medication, and it has more enduring effects. Cognitive behavioral therapy is an intervention that uses both cognitive and behavioral modalities to modify dysfunctional thoughts and behavior. So CBT, just in general, aims to elicit symptom change through 3 mechanisms: changing the content of those maladaptive thoughts, eliminating those thoughts, or through learning new cognitive and behavioral skills to cope with them. CBT was originally developed for depression and is now considered a gold standard in treating depression and anxiety, although versions exist for a variety of disorders as well.
Are there some conditions that are better treated with something other than CBT-I?
Absolutely. So CBT-I, cognitive behavioral therapy for insomnia, which you might be able to tell from the name, is primarily a treatment for insomnia. While it can be beneficial with other sleep disorders, these may be better treated with other methods. For example, a shifted sleep schedule or circadian rhythm disorders, they're sometimes better treated with light exposure, melatonin, medication, even prescribing naps. Insomnia, so again, that difficulty falling asleep or staying asleep, that should really be the focus of CBT for insomnia.
Tell us more about CBT-I. What does it entail?
Okay, so let's start at the beginning. The first step is typically keeping a sleep diary. We need to get insight into what is going on with sleep first, and a sleep diary can provide us with that great data. First, sleep is often better than we think it is. We have a bit of a memory bias for the negative, and this isn't any different for sleep. The bad nights tend to stick out in our minds more, so we can use the sleep diary to check out that correlation between events and our sleep. So, for example, maybe you can see that every day that I nap, I have difficulty falling asleep. The idea with the sleep diary is to get that first initial picture of what's going on with sleep before we decide how to treat it.
So what happens after the sleep diary?
Well, as we discussed earlier, sometimes CBTI involves discussing sleep hygiene, but another large component of CBTI is stimulus control. This is the idea that we associate places with what we do in them. The same goes for your bed, your bedroom, and wakefulness. It's a classical conditioning paradigm. You begin to pair your bed with wakefulness or anxiety if that state of mind or state of being occurs often enough in that environment. This is the same reason that people feel comfortable when they're at home, or when people walk into a place where something traumatic happened to them, they feel panicked and anxious. So associating wakefulness or wakeful activity or anxiety with the bed, it's not ideal.
So how do we use a sleep diary in restructuring our sleep?
Good question. One way is to guide sleep restriction, which is another large component of CBTI. I prefer to call it time in bed restriction because, to me, the idea typically is not to restrict sleep, although there are some situations where this is what I want to do. Instead, typically I want individuals to only spend the time that they are sleeping in bed, and it does mean playing around and usually constricting that sleep window. For example, if someone goes to bed at 10, because they've always gone to bed at 10, but now it takes an hour to fall asleep consistently, what I would suggest to them is not going to bed before 11, because you know that hour is just going to be spent with them awake and lying in bed and, will maybe become associated with some anxiety or wakeful thoughts as well.
Are there other components to CBTI?
Yes. So other components of CBTI include managing some of the anxiety or cognitive arousal associated with sleep. So that's when your mind races when you're in bed at night. Usually with typical cognitive behavioral therapy methods, although sometimes there are a few other tools and tricks specific to sleep. Cognitive behavioral therapy for insomnia always involves an education piece and managing expectations. So, for example, sleep goals might be unreasonable, or they may not really have any clinical issues with sleep and just be distressed about it. Like I mentioned earlier, maybe they've heard that you need 8 hours of sleep and they're not getting 8 hours, so they're really worried about it.
So I'm a big fan of mindfulness and concussion rehabilitation. How does mindfulness relate to CBTI?
Okay, so that's another component. Sometimes in CBTI, it involves relaxation training or mindfulness training. Typically, reducing the level of arousal before bed is key, but also managing stress, managing anxiety, managing some of those other mental health conditions as well in one's daily life can be very helpful.
So if you can give us one piece of advice on sleeping well, what would it be?
Tough choice. Okay. I would say don't worry too much about it. Your brain is amazing, and it will usually make sure that you get enough sleep. The only cause of concern should be if your functioning is impacted during the day. My one piece of advice really is to listen to your body. Sleep, unfortunately, is one of the few things in life where effort is not correlated with the result. You can't force yourself to fall asleep. Too many people go to bed because of a time on the clock, or because their family goes to bed at that time, or because they want to sleep at that time. Instead, listen to your body. Go to bed when you're feeling sleepy.
Excellent. Thank you so much. I'm sure we all learned a lot.
Thank you for listening to the Concussion 101 podcast. If you enjoyed it, please subscribe to our podcast on iTunes and leave us a review. For more information about concussion-related topics, visit us at www.yorkconcussion.ca. Stay tuned for our next episode.